Hey everyone, and welcome back to the channel. Today, we're talking about something many of us brush off as just a bad cold. The flu. We've all been there, right? You feel a little run down, maybe a cough, a bit of a stuffy nose. You pop some over-the-counter meds, power through your week, and figure it'll pass. But what if it's more than just a simple cold? What if it's the flu? And what if your body is trying to send you some serious warning signals? It's easy to underestimate the flu, but it can lead to severe complications like pneumonia, bronchitis, and even hospitalization, especially for young children, older adults, and those with chronic health conditions. That's why today we're going to dive deep into how to tell the difference between a common cold and the flu. And more importantly, how to spot the red flags that mean you need to seek medical attention right away. Sticking around for the next few minutes could genuinely make a huge difference for you or someone you care about. So, let's start with the basics. How do you even know if you have the flu? One of the biggest telltale signs is how quickly it hits you. A cold usually creeps up on you, slowly, over a few days. You might feel a little scratch in your throat one day, then a runny nose the next. The flu, on the other hand, often feels like you've been hit by a truck. 1 minute you're fine, and the next you're down for the count. This sudden onset is a key characteristic. The symptoms themselves are also much more intense. We're not just talking about a little stuffiness. We're talking about a high fever, often over 100 degrees Fahrenheit or 38 degrees Celsius, that comes on suddenly. You might experience intense body aches and muscle pains that make even lying in bed uncomfortable. A pounding headache is also very common, along with severe, overwhelming fatigue. This isn't just feeling a bit tired, it's an all-consuming exhaustion that makes it hard to do anything at all. While you might also have a cough and a sore throat, these systemic symptoms, the fever, aches, and fatigue are what really set the flu apart from your garden variety cold. So if you suddenly feel incredibly sick all over your body, that's your first big clue that it's probably the flu. Now, for most healthy people, the flu is a miserable week or two spent in bed, and then you start to feel better. But for some, it can take a dangerous turn. This is the most critical part of our video today. The warning signs that indicate you need immediate medical help. These are not symptoms to wait out or tough through. If you or someone you're with experiences any of these, it's time to call a doctor or head to an urgent care clinic or emergency room. First and foremost, difficulty breathing or shortness of breath. This is a major red flag. If you feel like you can't get enough air, or you're breathing much faster than normal just to feel comfortable, that's an emergency. Another serious sign is pain or pressure in the chest or abdomen. This isn't just a little discomfort, it's a persistent, noticeable pain that doesn't go away. This could indicate complications affecting your heart or lungs, so it needs to be checked out immediately. Let's continue with these crucial warning signs. Pay close attention to any neurological symptoms. This includes sudden dizziness, confusion, or difficulty waking up. If you feel incredibly lightheaded every time you stand up, or if you're struggling to think clearly and feel disoriented, that's a sign that the infection might be affecting more than just your respiratory system. For parents, this is especially important to watch for in children. If your child is unusually irritable and doesn't want to be held, or if they are so sleepy they are hard to wake up, seek medical care right away. Another warning sign is severe or persistent vomiting. It's one thing to feel nauseous, but if you can't keep any liquids down, you're at a high risk for dehydration, which is a serious problem on its own. And finally, a very deceptive sign. Symptoms that seem to get better, but then return with a vengeance, often with a worse fever and cough. This can be a sign of a secondary bacterial infection, like pneumonia, which has set in while your immune system was weakened from fighting the flu. Don't just assume it's a relapse of the flu. It could be something much more serious that requires a different treatment, like antibiotics. Recognizing these danger signs is crucial, but what can we do to avoid getting the flu in the first place? Prevention is always the best medicine. The #1 recommendation from health experts worldwide is getting an annual flu vaccine. The vaccine is updated every year to match the circulating strains. And while it's not a 100% guarantee you won't get sick, it significantly reduces your risk of catching the flu. And if you do get sick, being vaccinated can make the illness much milder and prevent serious complications. It's a simple, safe, and effective way to protect yourself and the community around you. Beyond the vaccine, good old-fashioned hygiene is your best friend. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water aren't available, use an alcohol-based hand sanitizer. Try to avoid touching your eyes, nose, and mouth, as this is a primary way germs enter your body. If someone in your house or at work is sick, try to maintain some distance to limit your exposure. Lifestyle habits also play a huge role in supporting your immune system. Think of your body as a fortress. You want to make sure its walls are strong. Getting enough sleep is absolutely vital. When you're sleep deprived, your body produces fewer infection-fighting cells, leaving you more vulnerable. Aim for 7 to 9 hours of quality sleep per night. What you eat also matters. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains provides your body with the vitamins and minerals it needs to function at its best. Foods high in vitamin C, like oranges and bell peppers, and zinc, like beans and seeds, are particularly good for immune support. Staying hydrated by drinking plenty of water helps your body flush out toxins and keeps everything running smoothly. Regular physical activity is another great way to boost your immune function. You don't have to run a marathon. Even moderate exercise like a brisk walk most days of the week can make a difference. Finally, try to manage your stress levels. Chronic stress can suppress the immune system, so finding healthy ways to cope, whether it's through meditation, yoga, hobbies, or talking with friends, is incredibly beneficial for your overall health. So, what should you do if you think you have the flu but aren't experiencing any of the emergency warning signs we discussed earlier? The best course of action is to stay home and rest. This is important for two reasons. First, your body needs rest to fight off the virus. Pushing yourself will only prolong your recovery and potentially make you sicker. Second, staying home prevents you from spreading the virus to others in your community. The flu is highly contagious, so isolating yourself is a responsible thing to do. Make sure you're drinking plenty of fluids, water, broth, or electrolyte drinks are all great choices to prevent dehydration, which can be a real risk when you have a fever. You can manage your symptoms with over-the-counter medications. Pain relievers like acetaminophen or ibuprofen can help with fever, body aches, and headaches. Just be sure to read the labels carefully and follow the dosage instructions. For children, it's especially important to never give them aspirin, as it can cause a rare but serious condition called Ray's syndrome. In some cases, your doctor might prescribe an antiviral medication. These drugs work best when started within the first 48 hours of symptoms and can help lessen the severity of the flu and shorten the time you re-sick. They're often recommended for people who are at high risk of complications, such as the elderly, young children, pregnant women, or those with underlying health conditions like asthma or heart disease. If you fall into one of these high-risk groups, it's a good idea to call your doctor as soon as you suspect you have the flu. They can determine if an antiviral medication is right for you. Even if you're not in a high-risk group, if your symptoms are severe or you're just not sure what to do, it never hurts to call your doctor's office for advice. They can guide you on the best steps to take for your specific situation. To wrap things up, let's do a quick recap of the key takeaways from today. First, the flu is not just a bad cold. It hits suddenly and with much more intense symptoms like high fever, severe body aches, and extreme fatigue. Second, while most people recover on their own, there are critical warning signs that require immediate medical attention. These include difficulty breathing, chest pain, confusion, persistent dizziness, severe vomiting, or symptoms that improve and then suddenly worsen. Never ignore these red flags. Third, prevention is your most powerful tool. Get your annual flu shot, wash your hands frequently, and support your immune system with adequate sleep, a healthy diet, and stress management. And finally, if you do get the flu, stay home, rest, hydrate, and consult a healthcare professional if you're in a high-risk group or if your symptoms are severe or worsening. Remember, this video is for educational purposes and is not a substitute for professional medical advice. Always listen to your body, and when in doubt, please reach out to a healthcare professional. Your health is too important to take chances with. Thanks so much for watching today. If you found this information helpful, please give this video a thumbs up and consider subscribing for more content to help you stay healthy and informed. Take care, and we'll see you in the next one.